obesity is a problem which has been increasing significantly over the past several decades, to the point where it's now a full-blown public health crisis. And the graph that you see up on the screen here is taken from data from a Congressional Budget Office report that was put out a few years ago at this point. But they basically projected that if healthcare costs continue to rise at the rate at which they've been rising for the past decade or so, by the year 2080, as much as 50% of the entire US GDP could be consumed by healthcare costs. And the reason for this increase is almost entirely an increase in chronic diseases. So acute diseases have, for the most part, been staying relatively stable or decreasing, while chronic diseases have been increasing rapidly. And those chronic diseases include obesity, diabetes, cardiovascular disease, and all those diseases have a strong dietary component. So the changing face of America's diet over the past several decades, if nothing is done to somehow reverse this trend, it has the potential to potentially bankrupt the economy. So this is clearly a huge issue. So we know that obesity rates have been increasing among adults. They've been increasing dramatically among children as well, 325% since the 1960s among 6 to 11-year-olds. Just recently, in the past couple of years, the data has shown that it started to plateau a little bit, which is good news, but it's still at an unsustainably high level. As you probably know, obesity on one hand is a pretty simple problem to understand from the energy perspective. It's basically an imbalance between energy intake and energy expenditure, where you have intake there on the left, which is basically food consumption, expenditure on the right, of which physical activity is one of the main components, and any imbalance gets stored as weight gain. So as we started to understand this problem by talking to many experts and reading hundreds and hundreds of